All right. Well, welcome to our monthly webinar. We do a webinar every month. This month's topic is why start or buy a pharmacy in 2025. I'm Owen Bondurant. I'm a partner in Independent RX. I am also a partner in a couple of pharmacies with Tim Clark, who is also on the webinar. And Independent RX, we're a company that helps people start and buy pharmacies, which is why we're here today. But we also service over 100 clients for accounting and tax, as well as helping people sell their pharmacies. I'll pass it over to Tim to introduce himself.
Hello, good afternoon. I'm Tim Clark. I'm also a partner with Ellen at Independent Arcs Consulting, and in a couple of pharmacies that we own together, a compounding and long-term care pharmacy. I'm a third generation pharmacist. Um, our family's been doing this since 1939, so 85 years. Owen's dad and I were partners, and Owen's dad worked for my dad, so we're quite familiar with each other. And we're also familiar with our family's passion for community pharmacy, which we ended up sharing. And, part of the webinar is for us to kind of give you a little bit of 10,000 feet up in the air. Where do we see things going? And we talked to a lot of different people in the industry, and even talked to our own employees. So we kind of have a different perspective to help you, and look forward to having this discussion with you, Owen.
Yeah, it should be good. We're just as an FYI, there is a Q&A button at the bottom of your screen. If you have questions at any point during the webinar, please drop a question in there. We'll try to answer them either as we go or at the end. This webinar is also being recorded, and we will send that out over the next couple of days via social, put it on our website and email. So again, we're talking about starting or buying a pharmacy. I guess I'd like to address kind of the elephant in the room, which is the question we get a lot is, should you even buy one or start one at this point with, PBMs are putting pressures on reimbursement, margins have come down. There's a lot more regulation now. So, the FDA is being tough on compounding pharmacies. We've got, more rules of, for example, pharmacists have to have lunch hours in many states, and we've got, all these different rules that we have to follow. So we get a lot of questions as to, is it really, something viable to even do? Um, I don't know if Tim, you have some thoughts on that.
Well, well, as we talk to other owners, the big thing that we've seen is that we're definitely have gone through some really bad times in the last 18 months, let's say, with the DIR cliff and all the cash flow problems that we've experienced. Have at least put into our minds that okay, this is where it is. And it's an inflection point. It's an inflection point, where pharmacy values are down. We look at the businesses like traditional retail, we'll call it, like the CVS, Walgreens, Rite Aid, have all changed their forecasts, and they're all going through some sort of reorganization, which is kind of where you, as a pharmacy owner or someone who's going to start a store or buy a store, you need to be watching and trying to figure out from other people, where is the business opportunity? Because the best time, and everybody in business will tell you, to get into business is at a low point. And there are successful community pharmacies out there. And I think, our discussion when you're starting and buying a store, it has got to be the fact that if you want to just fill prescriptions and get reimbursed by a PBM, and sign up with your wholesalers PSAO, I don't know if that's a good idea. So,
Yeah.
as we talk to people and we look at trying to figure out how to help them grow, and we're lucky enough to see people who are successful. I mean, just a few months ago over at NCPA, there's, I don't know how many thousand pharmacists were there, but there are people who are investing their time and efforts in this business, and to me that means that there is opportunity.
Yeah, I totally agree. And, I think people get nervous when things change. And, we've had a lot of change in the last 18 to 24, even 36 months. And frankly, I think to your point, it's an inflection point. I think there's even more that's going to change over the next 5 years. But I mean, anyone that's ever probably talked to me, my dad always talks about how things changed during his career. And he started in like 1980 or so. And when he started, you know, prescriptions were like 95% cash. And I think he looked up one time, the revenue per prescription was $8. So, but by the time he got through his first decade, it was like 80% was going to insurance. He was billing it via a computer, which he was not doing previously. And that was all in his first 10 years, right? We were still selling retail prescriptions, but it was done differently. And then he was like, oh, then we got into the whole mail order thing. And then Walmart came out with pharmacies, and that was the end. And then Med D came along, and that was definitely the end. And yet here we are, like 20 years later. I mean, things change, right? And when there's change and it causes things to go down, but like Tim said, it's also a good time to invest because if you can implement those changes, you can be out ahead of things and actually create opportunities. So, we are seeing, some of the reasons you want to look at this. I mean, Walgreens, CVS, and Rite Aid, I think CVS has already closed 600 and they're closing 300 more. Rite Aid's closed like 180, and Walgreens is in the process of closing 1,200 over like the next 2 or 3 years. So that is all opportunity. And the change in the market's what's driving them to get out of some of their stores, but could be an opportunity for you to get in. So, but you've got to do things differently. Like Tim stated, you can't just fill retail prescriptions. That's probably a component of it, but that creates patients that then you can now sell other services and it builds relationships with doctors and other healthcare positions that allow you to expand on your profession.
Well, one of the things that's different than how it was even 10 years ago is that now your pharmacy patient is going to multiple pharmacies to get all their prescriptions. It used to be that they would come into my pharmacy and fill everything. However, now with different insurance rules and reimbursement models, I mean, you're seeing patients not doing that anymore. So for you to say that I have to do everything isn't really true now. I think you could be again a specialist. Maybe you're taking care of let's say children. Maybe you're taking care of Alzheimer's. Maybe you're taking care of HIV patients. The advent of change creates this opportunity where you really can see yourself, having a dynamic job. And the thing is true is, we're about to go through another change. Like Owen and I were talking before we popped on this about the PBM reform bill that's just got introduced, which who knows what's going to be taken from that'll actually happen. Will it end up that Humana will have to sell their pharmacy business, or that it'll break up CVS Caremark? I don't know what's going to happen, but at least people are now finally looking at the the profit taking in different areas of our business that don't filter down to better care, which is really what we're trying to do, I think, in healthcare, is try to deliver better care at a I guess a faster, cheaper model. And people who are taking money in this, at least now we're going to start looking at it, as like, why do we do something? And that does come back to help pharmacies. Who knows what, you see a lot of stuff now, Owen, with AI. I have no idea what AI is going to do to our business.
Yeah, that's a
But
good point.
here, I can tell you this: there's going to be something.
Yeah. Oh,
You, you,
without
you
question.
know, now you can go. I look at my payroll provider, Gusto. Or probably anybody you're using. You get in there and you ask a question, and the AI assistant or whatever is responding to your question, and um, it's so much so that even in education, now, if you as your kids don't understand the lesson plan as it's currently constructed by the professor, AI can change that to have like a different message to your son or your daughter. I
Yeah.
mean, so there's we're definitely living in a pretty fast forward time. And I guess the fact of the matter is there are ways to get into this business to make money. I know one of your favorite things, Owen, is remote monitoring for patient care. Like
Yeah,
that's
I'm getting into because what I'm seeing is, yeah, I mean, I guess we have a couple of things. Tim was mentioning regulation, right? So we have this PBM reform bill. A lot of the Medicaids have switched to going to a fee for service. So they're doing an 8 plus, um, which is allowing them to add on other services as well. Um, we also, we went through the double DIR fees, so now they can't do retroactive DIR fees. Uh, so we've got all these regulatory things happening. However, outside of doing advocacy, we can't control that. So we can monitor those, we can, make donations, we can go to Capitol Hill, etc. However, we can't control those things. So I like to look at what Tim's saying here is there is market things that are happening. We can buy low and really we kind of feel like we're at the bottom. So between adding services and regulation change, you should increase over the next 10 years. And so, but you have to do these things. So like I'm looking at opportunities. So where I've gotten hot on the RPMs is I went to the doctor's office about a year ago and I needed a vaccine of some sort and blood taken. And I'm telling you, for the past 20 years of my life at this office, they have always just had me go over to the lab and they do both of them in the building. They've shut that down and he handed me a list of pharmacies where I could get this done at. That was what he gave me. And so I asked him, well, you guys aren't doing this. He's like, no, we need the exam room to be able to service patients just for regular, annual wellnesses and stuff. We can't do this stuff anymore. And so it's being pushed to the pharmacy level. Now, it might be being pushed to labs, it might be being pushed to urgent cares, things like that as well. But a pharmacy is a landing spot for a lot of stuff. And so one of those things is, as I mentioned, other types of vaccines. So not just flu and COVID, but also like remote patient monitoring. And what that is basically a little thing, if you're not familiar, it's a little thing that goes on your arm or what have you, and it basically monitors like blood pressure and, other vital things, and it sends a report back to the pharmacy. The pharmacist reviews it and then reports back to the doctor. Well, the doctor can bill that, and if you have a collaborative agreement, you can split that cost. So, and there's also chronic care management, and it's good dollars. And these are the patients we're serving anyways, right? So these are your chronic patients who are on 10 meds, and you're talking to about this stuff anyway, so you might as well get paid for it. Um, So there's things like that. There's, um, you know, one of the things that Tim and I have talked about a lot is charging for delivery. I mean, first off, we all do delivery because the chains don't do it, but we also used to always do it for free. Well, I mean, you guys, people are paying $9 to get McDonald's delivered. I mean, I would hope that they would pay $5 to have your prescription delivered. And that's just become the market. And yet the majority of pharmacies have not changed to go charge for delivery. It is just kind of what's happened. So, some of those opportunities are adding service lines. Some of these opportunities are just charging for the stuff that we're offering. Uh, and so, there's an endless number of these. I mentioned vaccines. Well, Tim and I went to a thing in NCPA, and these people were doing vaccine consults. So they would charge $60 to do a consult, and on average, the person booked a flu shot, and they come out with two shots plus $60. So
Oh,
somebody,
well, and
yeah,
that one person we met with, that has the travel vaccines.
yeah,
That's, kind of ingenious. You'd think that that's a one-time thing that they take a trip to Europe for your family, but no, it's someone who has, it could be their business or their lifestyle, that they do go to multiple places, and every time they go, they have to come into your pharmacy to get a vaccine. But trying to get that set up as your, um, you know, I guess a cash, you know, a cash model for the consultation and trying to get paid for your services, that's something we didn't do before. I think it really gives a great opportunity for again, pharmacists that are, again, we're educated, to do so much more than to do a check.
right.
I don't know if you need a pharmacist to do check anymore. I need a pharmacist to talk to people.
Right. Well, in some states are allowing techs to do a tech check.
And
And they're moving
probably
the
should.
farmers to do other things. And, these are the changes that are coming or have come. And how can you use your time to make more money? There's the travel vaccine thing was great. Diabetes education, smoking cessation, weight loss. I mean, a lot of pharmacies are able to bill that now to a medical benefit and get paid for, months in a row of like working with someone. Um, we see so many pharmacies that just aren't maxing their vaccines, right? So they've got 4,000 patients and they do 500 vaccines. It's like, well, probably the majority of those people needed a vaccine and they didn't get it from you. Um, we see people not taking advantage of 340B. Are they doing their MTMs? Like, these are the things when we see people who aren't doing well, they're not doing any of the other at all.
And I think one thing that is I've seen you counsel, a lot of people, is that I think for us, the pharmacist, we're so into today, this is what I got to do. I have these things to do. And, you're mentioning all these things that I could get into and make money. And the thing that I hear you say is pick one thing.
Yes, yes, yeah. Pick
You know,
something and do it.
you
Yeah,
got it. You can't pick three things and say that you're going to do those. But if you say, hey, I'm going to, let's say I'm going to get more into vaccines. Okay, then work on that.
yep,
You've got, probably patience. Go look at, when you go to, let's say, these conventions. Conventions are a great way to network and find out what other people are doing, and it's not, someone selling me to do it. It's actually someone like you that has a business, and you're like, so how are you here? I mean,
yeah,
like, why are you investing in your business? And typically everybody you talk to, and I think it's true, there's very few people that, that you see at NCPA saying, oh, like, oh, my business completely stinks. It's that they've figured out that they need to do stuff differently, and they're already doing things that you and I are talking about for all of us
Yeah.
to do. But having, whether it's message boards or different things that you get into, you really just have to start spending, a little bit of time for yourself. It's like exercise. I would tell all of you that you should exercise 3 to 5 times a week, and you need to do 10,000 steps a day. Okay, so you have to make time to go do that.
Yeah.
When was the last time you spent thinking, how am I going to be a little bit, educating myself on my business? It used to be that that again we had as pharmacists we get the magazines every month. You get your drug topics, you get your American Pharmacist, you get your all these different like promotional things that would kind of lead you into looking at stuff. But now you have to do things like I see, people getting on our webinars and other things, or you go back and you look at our YouTube videos. I mean, this is how you as a pharmacist can can learn without having to spend time and make a lot of mistakes. I mean,
Yeah.
mistakes are mistakes and fear, but do one thing tomorrow that's a little bit different. Watch a video or learn how to do something. I'm really surprised that, okay, how Red Cell bought Pioneer, okay, and how Red Cell also bought QS1. A lot of the times now in their marketing, even when you're dispensing a prescription on Pioneer, it's got a little ad that pops up on something that you can learn and do differently. It could be a new drug that's coming out that may be for you to dispense locally. It could be a webinar that they want you to watch. It could be their cash plus thing. But I find it amazing that now, even when I'm dispensing a prescription, I'm being told to go look at this.
Yeah.
And I would suggest to spend the time to go look at it, but do something.
Yeah, no, I totally agree. I mean, carving out some time and picking something and actually doing it, because that's probably the number one piece of advice is the clients that we see who are more profitable spend some time thinking about their business and then doing something. They pick something and they add it on. And, you know, I guess I do want to flip because I'm talking about adding things, right? So adding 340B, adding MTMs, adding RPMs, adding compounding, right? But we also are seeing clients who are looking at their current book of business and going, what can I do with that to make it more profitable? Right. So, for example, a lot of people are eliminating filling GLP-1s, especially on a billing insurance for them because, every 30 pills is $1,200. You make $1,190 on that. So you make a negative $10 on it. And then you got to wait on your money. It eats up all your cash. So going back to what Tim said, a lot of people get prescriptions from several different places. Most people don't care, and you can find a solution for it. And so now you've eliminated a high cash drug from your business that doesn't make you any money. A lot of people are also, figuring out, okay, I'm servicing 100 LTC patients. I'm going to add GeriMed, and I'm already servicing them. I'm just going to bill it to a long-term care benefit. Or I have, 80 patients who are homebound that can be, Medicare at home. So they're looking at their business and not only adding things, but also going, okay, let me go look at my current book of business and see, should I still be doing this the same way? It's kind of like the delivery stuff. Charge for it, right? So, and a great example of this, we had someone post here on the Q&A that said, we've been operating since 1965, always had free delivery. With decreased margins, we've discontinued delivery and we've gone to half days on Saturdays, from half days on Saturdays to close Saturday and Sunday. No decrease in sales, just a decrease in overhead. Exactly. Just because you did it like that in 1965 doesn't mean it needs to be done that way in 2024. And so when you're looking to start or buy a pharmacy, you got to wonder, should I be open on Saturdays and Sundays? I don't know if you need to be.
It's not like it used to be.
Exactly.
Like it, I think that's where I guess we started off just talking about the change in the pharmacy. I mean, you know, here's why you can charge for delivery now. DoorDash does,
Yes, exactly.
Uber Eats does,
Right.
Amazon does.
And they charge ungodly amounts of money. I mean, I'll go to Tropical Smoothie and I see a smoothie that's $3 with a $7 delivery charge. It doesn't make
Oh
any
yeah,
sense. But
and
there'd be
then you feel
40 of
bad
them
you
on
got
the
to tip,
counter.
and then you feel bad so someone's going to tip them.
Yeah,
Like
on
I
top
can
of that.
remember. I can remember when I was a delivery boy. I mean, it was even. I mean, back in the day, it was just expected. We deliver from our pharmacy, and it was very rare that I ever got tipped.
Yeah.
But now, I go through and I get my coffee this morning to to start the day, and you're tipping them $1, and I guess again the point is that I think the consumer is more used to things also changing.
Right.
One of the things that's also changed is that some people are charging further, and you have to look at your state. Every state has different rules about upcharging for um, let's say credit card fees. You might call it a service fee or something like that. There's um, why do I have to give someone 3%?
Uh,
I
yeah.
mean,
I mean, I don't know. Coffee shops and stuff have been doing that for 10
the
years,
best
15
the
years.
best thing you if you own a pharmacy can do is to bring someone in that doesn't own a pharmacy and tell them the stuff you're doing and have them sit there and say, why do you do that? Because I think that's your best advice can sometimes come outside of the pharmacy business because we're so sensitive to our customers and we change and we don't want to say no. It's just who typically pharmacy people are. But I think now, like if I was going to start up a store from scratch, I don't know if I'd sign every contract. And 5 years ago, I would have told you, yeah, you guys sign every contract with or with your PSEO and do this. I don't know if I would.
Yeah, I mean, we're seeing plenty of people who are not signing contracts. They're also choosing to only fill brands that they make money on.
Yeah,
So yeah, they see a decrease in sales, but the thing is they do less scripts, get more gross profit, and have less people needed to fill it all. Um, and those are the patients that they're servicing. I think you mentioned when we were prepping for this, Tim, also is some people are also contracting direct and not using a PSAO. That's not right for everyone. It is complicated and you have to look at your numbers, but you know, sometimes you might be able to get a better contract on your own at one of the insurance contracts or all of them. Um,
I think your dad did an analysis for me earlier this year when we were looking at some of our retail business, and he found like five contracts we had that were like 20, maybe 20% of our business, but they produced only 2% of our profit or something like that. So it was like completely not worth all the work to do to make really little to no money. I mean, it was like seriously, I mean, you do have to be better than like you can't say I'm going to take every insurance plan anymore. You can't say that. When I get the survey from our wholesaler asking me what am I going to expect on reimbursements? I don't know if you've ever answered one of these own, but when I answered, I only checked the highest number possible. I mean, I'm not going to check that I'm going to take. You want me to check the box to say that I want to take a contract that I lose money? No.
I'm even worse. I type a number into the other. That's
Oh, do you
even
do?
oh yeah.
Well, yeah, I'll do AWP minus 10. Thank
Yes.
you. Plus $5.
Um, but when with all of these things, and we're throwing a lot at you, you can't do all of this.
Oh, that's
Yeah, I mean, you can't do all of this. You can't, um, like, you have to pick a couple things that align with your business. But if you're looking to start and buy either this year or the next year, part of your analysis should be what of these things can I do to be different from the people who are just filling retail? So if I'm buying a store, I'm going, okay, they're only doing retail. Where is the opportunity? Is that I could buy better? I could do it with less payroll? Is it that I could add this service tomorrow and improve the profitability of this store? Um, and but the thing is today the majority of pharmacies aren't doing this stuff. And so you have an opportunity to go get and add on. And same with starting. You can't start a pharmacy going, oh, I'm going to fill retail prescriptions. You have to do something else. There has to be a model that you're going to add on or have as a supplementary piece to your business in order to get to profitability fast enough. Tim, you were gonna,
well. I was just gonna just talk about again, like if you're gonna help somebody start a store, for instance. I know like one of the things I would tell somebody is, oh, look at compounding.
absolutely.
There's compounders that are going to be for sale here in the next year, a couple of years, and either you buy one of them or you start one. There's still opportunity in the compounding business. There's some expense to get into it, but I mean there's no other business I can tell you that you can get into, but now you can make an 80 or 90% gross profit. So when we look at businesses, that would be the opportunity. Now, maybe you've never compounded or whatever, then maybe go to Mediska or something and one of their workshops, or look at, I think they've got some great stuff online. Some people still use PCCA. I mean, there's lots of different people who have information on compounding. But like go look at some of the educational stuff that either one of them have. That might inspire you. If you look at like what's selling at decent numbers, compounding pharmacies sell decently, and so do long-term care pharmacies. And the reason for that is that again, their margins are just better. Um, you're not going to get a 12% margin filling long-term care scripts because the Jerry Meds and the MHAs have in some ways protected that better than the other PSAOs. I mean, they really, I don't know why, but I guess it's because there's fewer of us, or we actually can prove that we're giving a different level of service. But if you look at, I think again, we did the workshop in NCPA for the long-term care at home. There's definitely going to be a need.
Yeah. Oh, there's definitely going to be a need. The amount of people who are, and all the insurance companies, Medicare, Medicaid, they're trying to keep people at home because it's cheaper. And so
And,
the amount
and
of
if you
people
had
that are
a
going to have to be serviced at home is just, uh, you, like it's growing by the day, literally. Um,
well, we're gonna live longer. It's
yeah.
like so I think again, what's kind of interesting again about the change is that now the consumer has changed. It used to be, I think we lost my mom's grandmother when she was in her 50s, right? I
Yep.
mean, and I felt like she was old in her 50s. I'm in my 50s. I don't feel old. I mean, I don't think I'm
Yeah.
ready to go yet. But again, the consumer, the consumer is so different than what it was 20 years ago when I was literally on the bench all the time. um I can remember not having an IVR, for instance. I mean, or
Mhm.
now you should be using Whippy or something
Yeah,
to
heal
text your
now,
patients, or some of the pharmacy
heal now.
systems directly
Yep.
will or Heal Now. I mean, there's so many um, different technology things that are available to improve the communication, which decreases your cost of your expenses are, typically it's your employee expense is the greatest expense that you can control, from your operations. I guess the next, typically, which is again bad management, is maybe inventory too. Like the way things work with getting inventory, you don't need to keep you know well, I forget what it was before, if we'd keep like 14 days on hand or something like that. I mean,
Well, I mean,
like
from a
you get 12 inventory turns,
yeah,
remember?
yeah. I mean, we used to strive for 12 inventory turns,
Can
and
you imagine doing
now
12 now?
most people are in the 20s, if not
Oh,
30s, because you can do med sync and you can do all these other things that
yeah.
your perpetual inventory is better. So, there's other opportunities. We've talked about all these other service lines, but if you look at a pharmacy to buy and it's at 12 inventory turns, holy cow, you have an ability to improve cash flow there, tenfold. Um, and all these other things. I mean, even automation, we used to be so against automation. Like we were always like, oh, well, you're going to buy this piece of automation. It doesn't really save you on labor, et cetera. Well, like retail automation, the price point has come way down and technician cost has gone way up. So suddenly, a piece of automation in a busy store might make sense. Um, and I can tell you, 10 years ago, we basically told everyone never buy automation unless it's for long-term care.
That's I think you're right.
Uh,
But if you're a busy retailer, you should be using automation because it doesn't make sense to have all these people counting.
yeah, absolutely.
Makes no sense. No
Yeah.
sense.
And frankly, the machines probably can do it better than they can anyways. Um,
Oh, no doubt.
yeah. And heck, now they've got technology to even check it. We did get one other question here. It says, how has durable medical equipment billing factored into changes in pharmacy? Um, we went through a period. Tim
That's a
actually,
good question for you,
that,
Owen, since
that is,
you started a DME company about 20 years ago.
yeah, and we did okay, and then competitive bidding came along, and we had to get rid of it. Um, However, they've kind of gotten rid of competitive bidding for the most part. There's still a few things that are on competitive bid, but we are seeing some of the margins come back in DME. Um, where with certain items, you're starting to see some profitability again. And there's certainly a lot less vendors than there used to be because competitive bidding basically got rid of all of them. That being said, my issue with durable medical equipment is it's a whole different type of business. Like billing it is with a different system. It isn't like real-time adjudication. You have to submit all this stuff to prove that someone needs it. So it's a lot different of a business. So getting into it is a little bit more difficult. That being said, because there's so few vendors, cash DME is amazing. I mean, you make like a 50% margin on it. Lift chairs and canes and rollators and all these bath equipment, all that stuff's not even covered by Medicare anyways. So um, it can be a good cross sale. And again, you're a niche healthcare provider, so it would not be odd for you to be carrying a line of DME um, out there. So um, certainly, I mean, if you've got a demand, especially on the cash side, I mean, sell a bunch of cash stuff and get people to buy it. Yeah, we've also along those lines, we've seen an increase in OTC sales. Um, I think consumers are seeing, in particular, independent pharmacies as somewhere where they can come and get advice. And so they ask you about products, and that allows you to cross-sell OTC items. Uh, it's harder for them to um, find some of these things, and they don't know. but it has to be things like, I want to be clear, having gifts or what have you is not it. You don't need a huge OTC. You can have a small OTC where you're cross-selling vitamins, for example, that help a specific disease states, DME items that your consumers would need anyways. It's things that they just can't find the quality product elsewhere or don't know where to go find it. Um, so, yeah. Anything to add, Tim?
I think the biggest thing that I go back to is how we started it. It's like I believe that when things change and you get it hitting the bottom, which I truly believe, we've kind of hit the bottom, is the right time to consider to get in.
Yeah.
So, there's people who are creative and innovative will survive and will prosper, and there's always going to be some failure with success, but again, as a pharmacist, you've got great opportunities to get into this game if you want.
Yeah, agreed.
And you got to just be careful that it doesn't end up ruining your quality of life. Some people get into the business and they don't realize like what it takes, and they don't know how to say no and create the boundaries that they need to, so that the business doesn't overtake them and their family.
Yeah.
So and I don't think you have to just talk to people who are in the pharmacy business to explain that to you. I think you talk to your friends that own a bakery or a hardware store. I mean, there's a different thing of being a sole proprietor, and don't do it just because don't do it because you're greedy. Like do it because you think you'd like to do it and try it and that you'd be good at it, and get some people to talk you through.
Yeah.
I mean,
That's good
there's lots,
advice.
and they don't have to be in the pharmacy business to give you decent advice.
No, no, especially on entrepreneurship. Uh,
No, no, heck, do I think one of the best things I did beginning of my career, I did a president's course at
yeah.
a local entrepreneur center, and met a lot of really good people who I still see some of them around town. It's kind of cool. I mean, and interestingly enough, I mean, well, lots of them have had success. They've had, everybody gets a blip or has, not everything is this Jeff Bezos kind of thing, but you can be successful.
Yeah. No, that's great advice. Okay, well, we'll have another webinar in January. We typically try to do them around the third Thursday of every month. This one is being recorded. We'll uh, get it all saved and up on our website and on social channels soon. Thanks for attending, and we'll see you next month.
Thanks.